live if you can hear me. The topic is the black swan, economic, social, and healthcare consequences of COVID-19. And for those of you going, black swan. Hi, Mr. Scriven.
Yes, I can hear you
now.
Oh,
welcome. Buenos días, bienvenido. Es un placer. Thank you so very much for being here with us. I know that we've probably eaten out a part of the time because we didn't have you earlier, but we were talking about the current situation of COVID-19 and the impact that it has had, but not just health-wise, but socially and economically. Can we talk about the short-term impact on economies, whether it is advanced markets or emerging?
Sure, thank you very much. And I like your statements in Spanish, but I prefer the Caribbean accent in English.
Oh, thank you. Thanks, as we'd say in Jamaica. Thanks.
So you hear me well?
We can hear you perfectly.
So first, let me apologize to everybody. I had problems with the connection. But good morning, everybody, and thank you very much for the invitation to this forum. It's a real pleasure to share with you, with such outstanding speakers and the audience, a debate that is very timely and very important. So first, let me introduce the institution I represent. IDB Invest is a multilateral development bank committed to sustainable development of its member countries in Latin America and the Caribbean, but primarily through the private sector. We're part of the IDB group, and we seek to support growth and innovation of the private sector through projects that achieve financial, social, economic, and environment development. As the region, as we all know, Latin America and the Caribbean has unfortunately been hard hit by COVID-19, one of the hardest hit regions of the world. Almost a third of the worldwide COVID-19 deaths have taken place in Latin America, despite only having 8% of the population. Total reported cases among 21 million, 20% total. So that's a very impressive number. But also, the pandemic also has had an uneven effect on the region and facing significant challenges. These cases are hit by second, third waves, local healthcare systems, especially in places like Amazonia, Brazil, and some of the Caribbean countries. In this context, the health system is the main sector that COVID-19 has put evidence on. Healthcare quality remains low, and more people die from poor quality of healthcare services than the lack of access. However, inequalities in access persist. Healthcare systems are fragmented, and countries in Latin America and the Caribbean are investing less efficiently in health than other regions, while facing fiscal and financial sustainable challenges. As we roll out the vaccines, and as you know, IDB Group and IDB Invest are significantly invested in helping roll out the vaccines. We have, as a group, supported and announced a facility for $1 billion to be able to access, for the countries to be able to access the vaccines. So I think we do feel that we want to be part of the solution. We do feel that the impact of the pandemic is gradually being seen in a number of sectors and a number of geographies. As our chief economist said, the pandemic is not, I would say, social in the sense how it impacts. The pandemic is expected to reverse the progress made in poverty reductions across over 2 decades in our region. Tourism-based economies, and Jamaica and the Caribbean is bound to it, which includes many of the member countries of the Caribbean, face particular difficulties considering the expected slow normalization of cross-border travel. Extraordinary but necessary fiscal packages have put public debt rising in all of our countries. And the truth is that the crisis has fallen uneven across social groups. Workers with less education, women, youth, those in contact intensive sectors, MSMEs, and more informal have suffered disproportionately livelihoods and income losses. So we do believe that there are studies enough to show that women are more impacted, certain regions are more impacted, and we have to do something about that. In this context, we are firm believers that the private sector has a crucial role to play in recovery, and that's why we, as an IDB group, are investing significantly in those. Let me give you a few examples. In health, public and private investment in response to pandemic has been a key factor for us. We've invested in online provision of healthcare system. Farmalista is a good example of that. It's a Colombian-based entity that is expanding to other regions. And what we've done in Brazil, for example, with one of the main hospitals, it's called Albert Einstein Hospital, is expanding the IC units and preparing them for an incoming significant number of people at risk, in particular in a country like Brazil, but more importantly in a city of Sao Paulo. How do we do this? We're trying to play a significant counter-cyclical role. On one hand, re-injecting, protecting, alleviating the sectors that have been most hit by the crisis. We're helping financial institutions, mainly banks, housing societies, building societies, or what we call cooperatives, providing them financial services to lend to SMEs. We provided a significant increase in our trade finance facilities. We're investing in specific sectors, and I would name tourism, manufacturing, agribusiness, and technology that we believe that are either most affected or will be part of the solution. We haven't forgot about infrastructure. We're in the business of building back better. And while some of the infrastructure projects, given the social distancing, have been slowed down, we continue to invest and look at that. We're not only a money provider, we're also a consulting firm in the sense that we have advisory services that are attached to what we're doing. So in sum, what I'd like to say, as nearly a year has gone by since the World Health Organization declared COVID-19 virus as a pandemic, it is clear that we're facing unprecedented challenges in the region. But also we believe that equally unprecedented opportunities to rethink and support economic recovery and growth in a sustainable way. Besides supporting the private sector to tackle the current crisis, IDB Invest is preparing to support the region and address some of the main long-lasting structural challenges. We're aiming to foster private sector-driven recovery through job creation, innovation, increasing the access of credit to small businesses, supporting infrastructure, advancing in climate finance, supporting gender and diversity, prompting digitalization, and catalyzing regional value chains, among others. Only a recovery based on sustainability can lead our societies toward a real, healthy, social and economic growth. Thank you so much.
Thank you so very much, Mr. Scriven. It's amazing that the things that you just mentioned, because earlier, Dr. Walcott and Kirk Anthony Hamilton over here, we were speaking about the very same things you were, the fact that private sector has got to be involved, it has a role to play. And we also spoke about, how the impact of Corona and COVID-19, the pandemic, has been multi-layered. So it's not just about healthcare and recovery, but it's also about trade and finance and building capacity and infrastructure and job creation. And so we have to look at this from a multi-layered lens. Is there something you'd like to add to what Mr. Scriven, and thank you so very much in terms of the work that IDB has done and giving access to vaccines and just doing its part. Thank you so very much for being the kind of example we need to see in the world. Dr. Walcott. Of
course, and hello to you as well, James. I'll try to speak in my Caribbean accent as well. But you said something very important, and it's the need for there to be sort of double down investment in healthcare, and to just sort of frame the success we've been able to achieve. We have been able to, again, condense decades of vaccine development into 12 months. But this was the product of years and decades of investment, right? And so I think it's important for us to realize that in order for us to navigate the current healthcare challenges and the challenges of the future, we have to double down on our investment to ensure that when the next massive healthcare crisis hits, we're not sort of behind the curve, right? And so this will require multi-sectoral collaboration, but the sort of common denominator has to be investment in healthcare.
Absolutely. Mr. Scriven, a question for you. We have registrants who are tuning in from all over. Certainly, a lot of them might be investors. Maybe some are entrepreneurs. Some would have had and felt the impact of COVID-19. Do you have any tips, any words of advice, even outside of the healthcare industry, in terms of how they can try to recover, or things that they should be considering in terms of trying to recover economically?
Of course, and my only first comment is please call me James.
James, thank you.
Thank you. Yes, so first, as you know, our angle as a development institution is a development of a country. And as such, we look at the private sector as the provision of jobs, the provision of services and products. So all my comments or all my suggestions will be in the objective of increasing the economic impact on individuals, sectors, companies. So what I would say is one of the biggest issues that we're seeing today is the adaptation of what could be a new norm. Unfortunately, we're going to have to live through the pandemic, even though vaccines will have an effect on how people move around and how comfortable people are. But we're going to have to live through our lifetime with this pandemic that will go back and forth. So what I've seen is a lot of requests from our clients. We've got about 400 clients. A lot of requests of our clients to help them adapt their businesses to an environment of COVID. And these are hotels, this could be a hospital, this could be a manufacturing company, it could be an education facility. All of them investing in preparing themselves for either a digital world or a more physically separated world. So that would be my first line of comments. The second one is all of this requires money and knowledge. I'd love to be able to be a provider of financing to all of your attendees, but also it's important that either you work with your local commercial banks or obviously call us. We've got offices in all your countries, can be contacted through our website and all, because we do feel that we want to be part of the solution. Because we have a very long-term view where our shareholders are the countries and include the government of Jamaica and many of the other representatives in your audience today. And we look at this as a long-term solution. We believe businesses are here to withstand the crisis, but we feel that after a period of time, things will come back, and we're very optimistic about this. Also, as I said, we're not only a commercial bank, but we're also a consulting firm in the sense that we can provide knowledge. So our products are attached and bundled by not only giving money, but also providing knowledge when it comes to impact on gender diversity, impact on climate. Is it adapting a physical infrastructure to the consequences of a hurricane, or consequences of all forms of climate? Also, when it comes to digitalization, we've got a group of people that look at the impact of a digital world on all this. So I would say a long way of saying adapt your businesses and also seek money to be able to expand your businesses and continue to grow.
Thank you so very much. A very comprehensive response there, but you gave them in bullet forms, very digestible, and I thank you so very much for your time. Again, kudos to you and the team at IDB, and I certainly look forward to meeting you in person one day, James. So thank you for your time, and all the best for 2021 and all the initiatives that you might have planned. We're sending you love and warm sentiments from Jamaica. Thank you so very much.
Always a real pleasure. I spent a lot of time in Jamaica about a year ago. I lived in Kingston for some time and willing to go back one of my best ice creams in the world is Devon House. So I hope to go
there
back
you
and
go.
have that. It's a real pleasure connecting again with all of you.
Fantastic. We can't wait for James to come back so that we can get him his ice cream, his jerk chicken, and everything that he desires. So thank you so very much, James. We're moving now into our very next session, and we're really looking forward to it. The topic is the return to normalcy, herd immunity.